sorry, I got caught up. I forgot. I was looking at making an encounter on D&D for how many rats you would have, because I just saw some random encounter of a druid has 100 rats and was it 3? City. Where is it? A party is confronted by a druid who claims that this part of the city is forbidden to outsiders and will back up his claim with a very large rat swarm, 200 individuals, and a dozen feral dogs. And I was like, I wonder what sort of level you'd have to be able to fight 100 rats, 200 rats. Anyway, we are back for some more Project Hospital. Hopefully today I can get some progress, because as I said yesterday, the reason that I'm not doing the five events in a row is because this game is very far back from where I was before. So that's why I'm going to do a few extra videos to try and catch back up. Hello Extreme Matt, thank you very much for joining me. So yesterday we put on lots more staff, so I should have lots more staff ready, and I don't know if surgery is available at night yet. We'll have to check that out later. But we're going to do an epidemic. Breaking news, food contamination at a local restaurant has caused a serious outbreak of illness. Even though health inspectors have closed the restaurant down, local hospitals must prepare for an increased influx of patients. An increased influx. That doesn't sound right. Is she one of them? Nope, she's got an ankle injury. Golfer's elbow. Yeah, he was the guy that didn't need the x-ray. Thanks, William Brown. By the way, Extreme Matt, what is your favorite hospital specialty out of all of these? Emergency, radiology, medical laboratories, intensive care unit, general surgery department, internal medicine, orthopedics, cardiology, or neurology? Reception, okay. There you go, you're now in the game. Oh, it's only got one T. Linda Taylor, procedures have finished. What procedures did they do? Interview, okay. Frank Lee's got bronchitis. I'm not letting him go without bronchodilators, come on. Katie Miller. Jennifer Moore has chest pain. Well, that requires a lot of investigation. Technically even an x-ray, but they don't find anything on x-ray except for broken ribs. So in this game, in real life, you would find cardiomegaly. Extreme Matt says, as that relates to me. No, you already selected reception. You are the daytime receptionist of the hospital now. You can't have your name on 2 staff. Come on now. I've got 340 followers to insert in here if they decide to show up for the stream. Reception wasn't one of your options? Yes, but it is an option. There's a receptionist here. And you chose it. Vomiting. Nice. What should I do with vomiting?
Drink water. Become meeee.
Thank you very much for the hydrate. I'll have a drink of water. Esophagitis? How do you differentiate esophagitis? Thorax percussion. Neck palpation. Barium swallow. Temperature. Oh, really? Jennifer Moore is... Alright, I'm going to admit her to cardiology. And I'm going to do... CRP, temperature. But what she really needs is ECG, echo, and angio. Linda Taylor has a simple fracture of humerus. Cool. Extreme Matt says fair. I'll reception the heck out of that schedule. Sure. I do complain about the receptionist in this game sometimes. Can you just send her to neurology because we're getting nowhere here. She needs tonometry, perimetry, and gonioscopy. Procedures finished. Amoebiasis. I'm pretty sure amoebiasis is only differentiated with a... Okay, never mind. They haven't done abdominal palpation yet. Microbial. Alright, this person's got pancreatitis or peptic ulcer disease. Pretty sure that's going to need an ultrasound. Temperature showed nothing. ECG? CT? Oh, they can do it fast? Can we do it fast? Doctors, nurses aren't available? What if I put him into observation? Yeah, then you can do it fast. Okay. Let's try that. Extreme Matt says hoodie or onesie. It's a hoodie. I got it from Warner Brothers Movie World when we went there last time. Oh, never mind. She's got Ciguatera. That needs mannitol doses under internal medicine. He's got a chest contusion. Cool. Have some numbing ointment. Yep. And you need a lower limb x-ray. Karen Allen, procedures finished. Awesome. She didn't. Wait, amoebiasis is internal. That's surgical. How do you differentiate Crohn's disease? Okay, we'll just admit her to ED then. And then she's going to get the full workup of microbial sampling, blood draw, CBC, serologic. Is that everything? You know what I'm looking for here, right? Stool sampling. She needs stool sampling. So whenever I'm hovering over these things, CRP should have been first. Whenever I'm hovering over these things, I'm looking at the investigation that they need in the middle there. It says CT enterography. That's what I'm looking at. Alright, Karen Allen can go for a bed in acute. As you can see, I'm trying not to admit people because... Is she up here? Oh yeah, she's there. I'm trying not to admit people because they take too much time when they get admitted. Yep, she's going for mannitol. Mannitol can drop your blood pressure. Mannitol is mostly used in the treatment of someone who's having a neurological problem that has become unconscious. And so you give them mannitol to draw the fluid out of their intracranial space. Oops, not that one. Oh, what am I doing that for? I don't want that. He wants antibiotics. Oh, and then we can discharge him. Okay, then. John Harris procedures finished. He's got breathing problems, headache, fever, fatigue. So let's go down the pathway. Neurological testing and speech listening for his headache. Breathing problems, needs chest auscultation. Fever, fatigue. Can check for an infective process with a CRP, and if he's septic, check his blood pressure. And I just do thorax percussion and neck palpation because in this game they often find things that are useful. Christopher Martin has got petechiae and fever. Let's examine that petechiae. Endocarditis is a cardiac problem, so we can check his blood pressure and neck palpation and thorax percussion. Infectious mononucleosis. I think that's going to need an oral inspection, right? Yep, oral. Nasal and oral cavity. Staphylococcal meningitis. I think that just needs an spinal tap. No, blood pressure. Okay, I'm doing that already. Yeah, CSF, there you go. Oh, never mind, it was staphylococcal meningitis. Because he's got neck stiffness. So he needs an admission under neurology for IV antibiotics. That'll be good. It looks comfy. It's okay. It's just an average jumper. It's not a thick jumper. And since it's not fully winter, I didn't want to go crazy and wear a really big, thick jumper. Because I'll probably get too hot then. I probably don't even need it anymore. But last night, early this morning, I was doing a stream and I was a bit cold. And it took me a long time to warm back up when I got back in bed. Fatigue and tremor. It's cholangitis. You also need an admission. Wow. For IV antibiotics. Beta blockers, no. Rest, yes. Vitamin subs, yes. Margaret Walker has carpal tunnel. She needs an admission too. For endoscopic surgery. Are we done? Who are all these patients? I think we still haven't seen Jessica Martinez. And Fraser Harris. Abdominal pain and vomiting. How do you differentiate between gastritis and peptic ulcer disease? Having a physical exam, so that's probably going to differentiate it. Oh, then he needs a gastroscopy and a blood test if it comes to that. Patricia Robinson. John Harris has got bronchitis. Nice. You can go home. See ya. Red eye, great. Never mind. Physical exam and skin allergy tests. Oh, never mind. We found it out. Hay fever. Antihistamines. Discharge. Bumfluff22 added his own. Well done. Peptic ulcer disease. Oh, he needs a surgical... I'm pretty sure he needs admission for that, but we'll just check. Uh-oh. Patricia Robinson has finished being investigated. But we didn't figure out what's wrong with her. Let's do observation. And she's gonna need vomiting, headache, fever. What else do you need for vomiting, headache, fever? Anything? Probably an ultrasound, but I don't know where. Sarah Lee, she's got an ankle contusion. See ya. Oh, here's another emergency. How old are we at? We're at 20% cured? Oh dear. Too slow. Nausea. Nausea, chills. Fraser Garcia, limited arm motion. I mean, X-ray probably won't differentiate it, will it? Probably should have done physical exam first. Oh! Whatever. Are these real ailments? Yes, these are real ailments. Real symptoms and real diagnoses. That's the difference between this and... oh my goodness, 2 Point Hospital, which came out at the same time. What is he doing chest auscultation first for? Physical exam first, boy. Okay, so this is easy to differentiate between bacterial and allergic. We just have to do a skin allergy test. If it's not one, it's the other. Pancreatitis. Well, I am admitting a lot of people to surgical right now. Where is Jessica Martinez? Alright, yeah, that was her. Walking up the hallway. Michael Wilson, procedures have finished. He's got a deep wound on the hand. He needs to go to orthopedics. Where is he? Yep. The orthopedics doctor should sort you out, buddy. Extremat says, yes, Project Theme Hospital. I do remember that. My sister had that game, and it was back in the day when we were all too young to to realize what sharing is. Or not we all. Me and my brother shared with each other, but she wouldn't let us play Project Hospital, so I had to sneak it. I actually, don't tell her that I did this, but I actually copied her CD. I burnt her CD, and then I used to play it on the burnt copy of the CD. So I wanted to play Project Hospital, but I wasn't allowed. It's not very nice. William King's got a dislocated shoulder. Okay. So he needs to be admitted. joint arm surgery. Joint surgery arm. Influenza B. Okay, you can stop doing blood tests, please. And just give him some antivirals. Susan Davis hospitalization over. Okie dokie. Thanks for your $3,360. Woohoo! Extreme math is too late. I've just told her. Oh well, never mind. Nothing she can do now. That was a long time ago. I don't even know where that copied CD is anymore. Allergic conjunctivitis needs antihistamines. Oh, well, we cleared out the emergency department. Oh yeah, see, X-ray didn't show anything for the limited eye motion because it's going to be golfer's elbow, which doesn't need an X-ray. Whoopsie. Alright, so we're at 50%. What are these people after? William Hill hasn't been seen yet? What? Where's he? Oh, he went to the toilet. You tricked me, buddy. Procedures finished for Fraser Garcia. It didn't show anything? What? Is he aggressive? Yeah. Oh no, he doesn't speak English. Well, I don't know how to differentiate this anymore. An ultrasound, maybe? X-ray was done. EMG? Okay, temperature measurement. What was that? Oh, ultrasound. Whoa, did you see that? He just flipped. Someone clipped that. I want to rewatch that. He just flipped himself up onto the bed. Oh, this guy's got hemolytic anemia, which is an internal medicine problem. Not enough stretches? Yep, okay. Not mycologic sampling. Holy cow, they didn't find anything from the temperature? Okay. Next. EMG. Ultrasound. Alright, let's do an ultrasound. Extreme Matt says, time machine, mate. She's got you there. She doesn't. Okay. Understood. Good. Discharge. You don't need to wait in hospital. Why is he not being seen? Oh, he went to the toilet. Now the doctor went to the toilet. Where's Jen 99? Oopsie. No, this one. This button. Holy shit, he's going to the furthest toilet away. I'm gonna switch him to Bumfluff 22. After Bumfluff 22 gets some water. Go. Go, William Hill. Where did I put my phone? Oh, I'm using it for chat. Wait, why? Oh, is he a new patient? Alright, gotcha. Procedures finished for Jordan Lewis. Okay, okay. He didn't tell me anything. Procedures finished. Surgery. Nice. Never mind. He's got campylobacteriosis. So he is cured. Just give him his antibiotics. And then we can check what the rest of the patients need. We have to wait. What's that? Oh, he doesn't clean his hands. What? Okay, Karen Allen. What's Karen Allen doing? She's got amoebiasis. She's waiting for a bunch of stuff. Where is she? She's in the toilet. I'll be back for you, Karen. Patricia Robinson. Vomiting, headache, fever. I didn't discover what's wrong with her. It's going to be salmonellosis. How do we differentiate salmonellosis? We do stool analysis, which is already in lab. Microbial cultivation is in lab. Okay. This was the game that I did, gave the extra staff in lab, didn't I? Yep. Mark Smith is collapsing. Oh, he's the new resus patient that came in. Code blue him. And while I'm at it, I'm going to code blue these people. That's inappropriate. What's James Young doing? They didn't give him his treatment. Okay, 90% done. It's just Patricia Robinson left. Okay, so we can uncode blue him now. He got his proton pump inhibitors. And Karen Allen. She can be discharged. Margaret Harris has got tetanus. And she's already had respiratory failure twice. Uh-oh. And no one's given her her IV immunoglobulin. Maybe you should treat her diagnosis, guys. Why is someone not being treated in their diagnosis? Where is all this blood? Who's bleeding? No, I'm on the second floor. Go down. %90 done. Come on, Patricia. Oh. Is there anything I can do to hurry this up? Blood pressure? CSF analysis. Should I do a CSF analysis? Yes. But where is it? Can't be prescribed at this department. Well, she just went up to 5 stars, but she ain't gonna stay there after she gets a needle jabbed in her back. Okay, why are you not doing this guy? He's just been left there with IV fluids. What are these guys doing? Headache, her fatigue, dizziness, palpitations. This guy's got congestive heart failure. Oh, yeah, keep him on the heart monitoring. And also have ACE inhibitors. Like, so much slips through the cracks in this game. It's so frustrating. Like this lady, she should have had her IV immunoglobulin probably ages ago. Anyway, back to Patricia. How is it happening? They just picked her up from the toilet on a stretcher? To go to HDU. Nice. Because I want them to do CSF sampling. ED physicians can do CSF sampling, why can't I do it? Oh. Where's the HDU? This one? Yep, because of the monitors. Oh, it's salmonellosis. Cool, so she wasn't neurology. And what does it need? Antibiotics. Let's give her everything because she's already admitted. Come on, guys. Get your stretcher back out. Yep, there you go. Now he's got to take her from here to internal medicine ward. Which is... which colour? Which colour was internal medicine? This one. Pink. Nope, that's neurology. This one. No, that's ICU. Check. Oh, here. What color is that? Oh yeah, pink. Same color as ICU? No, ICU is blue. Anyway, it's just around the corner. She didn't go far from her required specialty. Extreme Matt says, do you find this cozy? Did you watch my stream from yesterday? Did I look cozy? Was I having a nice cozy time yesterday? Yeah, at points it's cozy. And I've done this as a real job, so... Yeah, we did the event! I've done this as a real job, so it's cool to see how accurate it is. And it is pretty accurate to real life. Alright, time for another epidemic. Should we roll straight on to the next one? Do we even have space for this? Tourists returning from vacation have fallen ill while travelling home. Patients are being transported to nearby hospitals straight from the airport. But the swearing is part of your chill, innit? No, yesterday I was not chill. I was getting so mad. I was so mad at this game yesterday. Painful urination. Is that a UTI or is it renal calculus? Hematuria. Is that a UTI or renal calculus? Oh, where is he going? Why is he's going to a cardiology appointment for his hematuria? That doesn't sound right. Yep, cool, discharge her. You've got glomerulonephritis. Can I just give corticosteroids? Yes, I can. That was a pretty smooth event, the last one. Is this guy part of the event? No. Subdural hematoma. Meniere's disease. Off to neurology with you. Sweating. Lymph node swollen. Malaria. Bye. That was another easy one. Slam dunk. Is any of them coming by ambulance? No. So this symbol here, they're all in the waiting room. If they were coming by ambulance, they'd have a little ambulance symbol next to them. Fraser Gonzalez has got campylobacteriosis. Good. I can sort that easily. Fever, abdominal pain, headache. Awesome. Diarrhea. Discharge. Oh, he's already got a diagnosis for Meniere's disease. Look at them pumping through the patients. These guys are champs. No breaks, just seeing patients one after another. Come on, kid. Good. Oh wait, she hasn't finished yet. Who was that? Oh, she's waiting, long wait for examination, CBC sampling. Why? Where is she? Cardiology. Okay. Okay, so he needs an oral examination. He's got Meniere's disease. She's got malaria. Good work, guys. What are we on? 40%. And we've still got nearly 14 minutes left. Good. So good. So you love this game when it works well. When it works well, you can just... The system goes well and you just get everything done so smoothly. When there's a problem though, the whole thing falls apart and people die. Oh, she didn't figure out what it was. She's got diarrhea and fever. Antipyretics, no. No, none of that. Just antibiotics, please. Charles Adams has breathing problems. So breathing problems could be respiratory, so do a respiratory assessment. Could also be cardiac because fluid overload, so do neck palpation, blood pressure, thorax. It could also be a chest infection, so do CRP. What else could breathing problems be? Oral cavity inspection could be, and then I did all that investigation and it's actually just a poison ivy rash. Nice. Is he one of the? Here we go. Jen in 99 is over investigating again. Wait, I think I slated those. Jane Hernandez. CRP showed nothing. What else can we do for diarrhea fever that is not? I don't think any of that's going to show up, but we'll try it. And if it's none of those, then she has to go get a blood test. Cha-ching, $240. Oh, it didn't show anything. Nice. So put her in for observation, and she's going to need a bunch of investigations. Okay. Michael Brown. He's got fever and diarrhea as well. Jane Hernandez is going to be a problem, I'm gathering. Okay, he's got Campylobacteriosis. Now just how do we find it? ELISA testing. Extremat says, are these all things you know how to treat in real life too? I think they have US names for a lot of stuff, like Campylobacteriosis. I can guess that it's a bacterial infection and that you would need antibiotics for it, but I don't exactly know what it is from real life. Refers to a common infection caused by Campylobacteria jejuni. Jejuni is probably in your jejunum, and Campylobacter is the name of the bacterium. It's often a foodborne illness, so it gets treated with antibiotics. HUS is hemolytic uremic syndrome, so that's where you got blood in your wee, and it's coming from your kidneys. Your kidneys are bleeding, and the treatment is not blood transfusion. You would have to, you'd have to treat the Escherichia coli, which is a bacteria that you'd have to treat. But this game just treats it with a blood transfusion. Nice. Robert Wright is collapsing. I know subdural hematoma. I've had a few patients in emergency with that. They have to go for operating theatre and maybe a... Yeah, look, this idiot is collapsing. He's not the idiot. The staff are the idiots for not getting his treatment done. Code blue. Oh, that didn't differentiate. Is this both? Oh yeah, it's both surgical. Oh, he needs ELISA testing. I've never heard of ELISA testing. I don't know what that is. A blood test of some kind. Judy Green procedures have finished as well. Awesome. Is there something that I can investigate here without admitting her? Oh, what? Where's my... Oh, yeah, it's done. Okay, so that showed one thing. She's got a fever. But that's still not helping. That still didn't fully diagnose it. Yep, blood test, stool test, CT, enterography. And there was another one as well, microbial. Let's do evaluation first. Maybe that will give me something. And if that doesn't work, then we will do blood test, stool test. And it didn't work. Blood test, microbial, CBC. Serologic stool. There you go. And we've got 12 minutes for that to be sorted. Pancreatitis. Oh, she's had everything treated for it. I don't know what you want me to do for her. Oi. Oh, done. What? But what about Judy Green? Objective for insurance company has been completed. Oh, treat 30 patients per day at emergency. Oh, okay. I didn't do that before. Thank you. Extreme Matt says, I'm impressed and you had to learn all this? Oh, you learn it through experience. I didn't learn it all through uni. I didn't learn much at uni, to truth be told. Because I was already an enrolled nurse, so I did a lot of my, I got a lot of my knowledge from practical experience. But, and so maybe that's why I didn't learn a lot at university. Or I feel like I didn't learn a lot through university. And it was only because I worked in a very busy, high acuity emergency department that had a really good support system and training system that I learned how to deal with as many problems, how to deal with as many clinical patients as I did. if I was in a small department, I probably wouldn't be as highly skilled as I am today. So I'm very grateful to the workplace that I had and the training and experience that I received from working there. Okay, well that. Oh no, we haven't finished the epidemic. Don't jump in it. That wasn't finished. We're on at 80%. Okay, so it's gonna be Campylobacteriosis. How do we differentiate that it's not Crohn's disease? Stool, blood test, CRP was done, right? CT, oh that's the thing that I didn't order was CT enterography. Uh-oh, Thomas Garcia is collapsing. Why is he collapsing? Why have they not treated this guy yet? Deep wound on foot, deep wound on leg. Oh, because the guy is back to doing this shit. Does he need an x-ray? Is his CHF being treated? Yes. There's so much blood all over the floors. Extreme Matt says, "Oh, you're so cool. I hope you are treated better than the health workers are during the UK during lockdown." Nope, we weren't. We did this thing where we were clapped on our doorstep every week at 7 p.m. It was silly, yeah, and not helpful, 100%. No, so the union was asking for an increase. So during COVID, they also offered a pay rise, which was not even enough to cover the rising cost of inflation and cost of living. And the union said that they don't want that. And it was really, and also at the time, the politicians decided they should get a really big pay rise. So that was the thanks we got. Then the next day they had the state premier or something out clapping and saying thank you to all the healthcare workers. If you put the two news articles next to each other, you could see how ridiculous it was. Michael Wilson needs to be hospitalized. Okay. %, in 10 minutes. Come on. It's always the blood tests that screw you over. And I don't know how to make that better. I have increased the staffing. How much staff is on at night? Maybe we need more staff at night. No, there's 2 here, and 1 here. But that's histology. Like, that's not what we're doing. We're not waiting on histology. We're waiting on hematology. Right? Not that one. Michael Brown is waiting on, this one is hematology. This one is hematology. Jane Hernandez is hematology, and ooh, well, her poo is waiting, but there's not that much histology stuff. Hematology, microbiology, and hematology. He's not happy. Let's go for regular admission then. Elbow bursitis, corticosteroids. Yesterday I was playing Ortho didn't do this silliness where they weren't treating their patients. Extreme Matt says, you folks were done over too? Oh, we weren't done over. They just didn't give us the pay rise that we deserved. And I don't think that was ever resolved. I heard NZ folks kept the numbers low by locking borders earlier. How did you lot cope during lockdown? Well, our numbers were not that high for COVID. COVID was fine in Australia. We had a whole bunch of preparations ready in case we got overwhelmed with patients because of the problems in US where they were having overloaded ICUs and nowhere to put patients who needed ICU. But we never actually got to the stage that needed that. We never actually got to the stage where we needed to activate that, I don't think. I think they ended up activating it anyway, but our ICUs were never full and overloaded and struggling. And the lockdown was fine. I don't go out anyway, so for lockdown I was fine. I just came home and lived my normal life. I don't go around. And as a essential healthcare worker, they had special times where you could go to. They opened their shops, the grocery shops, at like 6 a.m. or something, so I could go there and pick up stuff. And all this stuff came out about where you don't have to talk to people. You can I don't know what it is. Like a lot of shops started doing just paying with the touch and go, and I don't know. Was there an increase in non-face-to-face? Oh yeah, the delivery to your door, pick up your deliver to your boot, all that stuff happened during COVID and it wasn't free, and it was great. I was like, yes, I don't even have to go in the shop anymore. It allowed me to be much more antisocial. It supported my antisocialness. What are they doing with this guy now? Why is he coming into here? They haven't sent off the Elisa? Ah, schnitzel. Botulism. What? Long wait for examination? Oh, she's having her CT done. That means it's not going to be special privileges. Nice. I didn't fully take advantage of the special privileges. I didn't feel it was necessary. Employee was drunk and won't be... What? Won't feel too good today? Oh, poor Diddums. Don't drink so much when you know you've got to work the next day. Deep wound on leg. Oh, cool. What showed up? The blood test? Oh, the microbial cultivation. Alright, so that's Judy Green done. Now it's just Jane Hernandez and Michael Brown. And is there no surgical... What is this? Diagnostic unit upstairs? Okay, I think I'm going to make a surgical diagnostic unit. And you know what? We can make this... We can use this space. I don't know why I didn't do that originally. Floor. Blue. And then surgical. Regular ward. Oh, fuck off. I haven't finished yet. Missing equipment? What? I didn't take any equipment out. Oh, wrong side. It's over here. Oh, because the wall. The defibrillator was on the wall. I was hoping that I'd be able to fit an extra bed in here. Oh, can't put that there, maybe there. And then a... Does it need the overhead thing? This thing? I don't know how to rotate the camera. There is an achievement for rotating the camera. Bed socket. Yeah, this thing. Does it need that? And a bedside table. Is that all? Yep. Alright, extra bed. An achievement for rotating the camera. Yeah, it's like yesterday there's an achievement for rotating an object 10 times before you place it. I don't even know what the rotate camera button is because there never used to be a rotate camera button in the game. Show keyboard controls. Rotate object. Move camera. Floor up, switch mode, rotate view. What is that? This button? Yeah. Oh shit, I don't know where I am now. Am I on the right angle? Nope. Nope. Yes. Yesterday. Did you see that? Did you see any cool April Fools yesterday? Nope. I told you, I don't go out of the house. I love staying at home. I got in trouble for not getting the Hello Fresh box inside because it was out there, and I was like, I don't know it's there. I didn't go out. And for everyone's information, yes, I did. Yes, I did get the Hello Fresh box in yesterday morning. Where is it? It's one of these hidden achievements. I don't even know why these are hidden. 100 times. You have to rotate the camera 100 times. That is so many times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40. Okay, well I did it. I already did it 60 times apparently. There we go. What a dumb achievement. Never stop spinning me. Yeah. Diarrhea and bloating, but they're doing speech listening. Okay, that sounds... X-ray a lower limb is done. Is he admitted? No? Yes? No? Whatever. We're still on an event. Still waiting for Bloods to come back. Casey Moore. Inclusion body myositis. Jane Hernandez is collapsing. Why is Jane Hernandez collapsing? Because she hasn't got a diagnosis because the pathology is too slow. Yeah, okay, I don't need that. Oh. Oh, they're moving her to TC now. Ooh, what's this person doing? What is this person doing? Okay, you can go to orthopedics. Okay, bacterial gastroenteritis was treated. Nice. Bye. Extreme Matt says, did you see any cool April Fool's things? I deleted Facebook for 3 weeks. So I probably have been out of the loop for social media. And I'm thinking I might delete it again. I don't think I want it. Why is there no cleaner here? There's no staff in the... Oh my goodness. This game is so fail. I was such a noob back when I played this game. Why did I not have staff in here? There is toilets though, yeah. And this is the toilets that yeah. What about this corridor? Who is this? Cardiology? And do I have a cleaner in cardiology? Yeah, I've got lots of cleaners. I've got 3 cleaners. He's busy cleaning this blood. Okay. Cool. What now? Why is he still here? Oh, he's hospitalized. Okay. Well, then you can have this stuff too. Seriously? Okay. They sent him for observations. 86! Oh! No, that didn't do anything. Great. We're still waiting on Jane Hernandez and Michael Brown. Please hurry up. I only have 7 minutes left. I haven't done anything with these guys for the last 4 minutes. Ambulance. Is there imaging that I could be doing here? Stool, speech.
Drink water. Become.
Cheers. Thank you very much for the hydrate. No, we're just waiting for the ELISA testing. There's no imaging. I just need the ELISA. What is ELISA sampling? It is... doesn't tell me? Required room hematology. Huh? Yeah, he's fine. Hematology lab for that one. How come it doesn't tell me on this one? Don't tell me it's not been taken. Where is he? Michael Brown? He's in surgical. Where is she? Campylobacteriosis is surgical. Let's move her to surgical. That doesn't help me with getting stuff done faster. No way. Jessica Martinez, long wait. Is there no ultrasound overnight? Oh, there's no ultrasound here. Let's move this guy, Daniel Walker. No. Oh, what? I need a sonographer. Okay, fair enough. Sonography and biochemistry. Great. Such a waste of money, these guys being employed to do this. But there's no notification to say someone is waiting for one of these. If there was a notification to say, oh, you've got 5 patients waiting for CT, then it would be good. I could cut down on the staffing and just rotate them around when I need them. But since I don't know how many are waiting, I got 5 minutes and these blood tests are not happening. Why? I mean, I could add an extra staff member to histology, but there's only 1 sample waiting. Cribzino, hello, thank you. I saw you followed me. Thanks very much for the follow. I don't speak English, I'm Brazilian, and I love Project Hospital. It's very difficult for someone to do a live stream of it here. I have the game. I added some things I saw in the stream community. It's a fantastic experience. Thank you. I'm glad you're enjoying it. You can go and catch all of my Project Hospital videos over on YouTube if you're interested in seeing some more content, like where I came from. But I'm also a nurse in real life, so a lot of my knowledge that I keep spouting here is through my experience of being a nurse. My workmates can't understand why I play this game because it's like going to work. It's like going home from work to be at work and not get paid. Patient flow. It's a very good patient flow simulator. But yes, you're welcome. welcome to come and join us. We love having you. Love having you here. There is so much blood in this corridor. Oh, he's on it. He's on it. Okay, good. There's some things in this game which I just can't figure out how to improve. Like pathology takes forever, and transfers. Oh, transfers was a problem, but I figured that out because I learned that you can make a nurse do patient transfers only. Like this one, Mary Robinson, she's the orderly. And then theatres at night has been a real pain in the ass, but I think I've figured it out now. Maybe. Crispzino says, I was a little surprised by the size of your ward and semi-intensive care unit. Mine are big. I receive a lot of patients. Yeah, I try to keep them as small as possible. My ICU used to be bigger. Before I got a new computer, this ICU was also up here. But I found that I hardly ever used it, so I try to keep my patients in the lower. So in real life, ICU beds are really hard to get into. So I try to keep my ICU beds down and keep them in the lower acuity settings. Probably why my patients often crash and are collapsing, because I don't have them in a high enough acuity setting. There you go, see Paul Miller collapsing with a hemothorax. That really should go to ICU. If I change him to ICU, will that help? I don't know. They're going to treat him at the moment. And then I've got a couple of wards that are doubled up. So I've got 2 surgical. No, I don't. I've only got 1 regular. Is it surgical? Oh yeah, I've got 2 surgical wards and an HDU. But yes, otherwise, mostly just 1 minimum sized ward. Now I've got 2 cardiology units too. So there's this cardiology unit here with a ward and a CCU, and also down here on level 1. And then this one is internal medicine, right? Yep. So there's 2 internal medicines, I think. Yep. I might slate some treatment for that too. Where is she? Why is she... I probably should have put her in for observation. Oopsie. Size of semi? I don't get it. Yeah, so my ICU used to also take up this space here. But then I got a new computer and I forgot to transfer my save across, so I lost a lot of my progress. There's no free bed for ICU? Oh great, thanks. You've just jinxed me. Okay, I'm going to increase the size of my ICU now. I'm not going to go as crazy as I did before though. I'm just going to do this. But I'm going to delete the door. Where is that? Oh, it automatically deleted. Cool. And then I'm going to delete this wall. Patient's bed got broken. Oh shit, they need the wall. Ah shit, I know. They'll be sent away. No, don't do that. It's a blue white stripe, right? This one? Here. Now I need... What goes on the wall? Wait, did I? What did I lose? The bed got broken. How did I pick that up? I didn't know you could pick up that thing. Is it unbroken now? Quick, tell me, is my wall okay? I don't want 2 ICUs. Can I make it into 1 ICU? Oh, shit balls. Is it unbroken now? It appears to be okay. Monitor patient collapsing. Oh, she's the one that hasn't got a diagnosis. She's already had CT enterography before. But okay, send her for another one. Oh no, wait, they don't need. If CT enterography is the problem, I'm going to be mad. 93%. Someone's bloods came back. Michael Brown. Yep, campylobacteriosis. Do you reckon I should just choose campylobacteriosis and treat it? I'll put the walls back down. Why did he walk away after doing one thing? He's still got 3 more things to do. Patient's room was broken? The room is not broken. The fuck? What's broken about it? Okay, hang on. Hang on. Yep, thank you. Oh, this thing? It's this thing. It is a life monitor. Yep, that was the problem. Whoopsie. They'll have a life monitor now. This one. There you go, that made the ICU nurses do some work. Oh, okay. Sorry, Crypzino. How do I allow you to do links temporarily? Permissions? Exclamation mark. Permit. Exclamation mark. Permit. And then what? Username. Permit Crypzino. Okay, there you go. Repost your link now, Crypzino, just so that I can click on it. Procedure's finished. How is procedures? Oh. How have they not figured out whether it's in the leg or the foot? Because we haven't done a physical exam yet? What the hell? What are they doing over there in emergency? Cribzino, quick, post your link again. You only have 60 seconds. Yes, send the link again. Because Nightbot... No, yeah, Nightbot? Oh, never mind, you have to do it again. Hold on. I'll redo it. You only have 60 seconds. Exclamation mark, permit. Crip. S-Z-I-N-H-O. Now, do it now. 60 seconds, go. Repost your link again, please, Cripzino. Procedures have finished, finally. Wound closure. Do all the stuff. Quick, 60 seconds. I need your link again. Never mind. Send it to me in a whisper. Send it to me in a whisper and I'll have a look at it. How am I going? 93%? We're still waiting on Jane Hernandez. What was it that came back? Elisa testing. We're waiting for Jane Hernandez. Elisa. There. Oh, she had bacterial gastroenteritis. Why? Oh, the microbial cultivation came back. Antibiotics. Oh, we did it. 2 minutes, 24 seconds. Not as close as it has been before. I've been down to the last 10 seconds before and won. Sorry, Cripzino, you're not getting your link posted because you only have 60 seconds after I give you the permission to post it, and I think you're outside the 60 seconds. So just send it to me in a is it a message? What is it called? Whisper. Just send it to me in a whisper and I will have a look at it. To do a whisper. To do a whisper, you just click on my name in chat, and then click whisper, and then I'll get your link in the whisper and have a look at it. Reach 90% prestige. Yeah, what's my prestige? 50. 60%. That's not happening soon, is it? Oh, awesome. She's in the CT while I want her to get antibiotics so that I can finish. And I only have 1 minute 53 seconds. Holy cow. Good, she can go. $400. It's only Jane Hernandez left. Come on, Jane. Get those antibiotics. Wait, where is Jane? Oh, she's an emergency patient, I think. I really want her to have her antibiotics before I move her to surgical. That would be great. Just checking that there's no patients waiting for me to do something. Yeah, done. You're able to complete the event in time. You gain a prestige boost for this day and a money reward. Congratulations! Gee, it didn't boost me much. And that is 2 of 3 epidemic events. Should we roll straight onto a third? What time is it? 11:40? Yep, let's do a third. Here we go. I'm doing 3 back-to-back ones. This is insanity. Food contamination at a local restaurant has caused a serious outbreak of illness. Even though health inspectors have closed the restaurant down, local hospitals must prepare for an increased influx of patients. Woo! Yeah, victory! Thank you, Extreme Matt. I just am trying to get myself back up to where I was before. What is this the first? This is the first one, right? I didn't do the other 3, or did I? Oh yeah, I did the other 3 at last. No, that was just 3 standard ones. We've still got to do 3 disasters and 3 accidents, I think, before we're back up to the 5 events in a row. Oh, is there ambulance patients coming? Oh, there is. There's 2 ambulance patients. Oh, Schnitzel, how's my resource? Empty. Nice. Get to work, doctors. It is time to treat patients. First cab off the rank is Daniel Harris. What has he got? What do we got? Can anyone name where that quote is from? Gallstones or cholecystitis from a bad food at a restaurant? Well, I think that person is trying to get an insurance job. That's also, celiac disease is also not a problem that you get from eating bad food at a restaurant. Yeah, but they might have eaten fatty food and got an activation of gallstones. Okay, clear out time for orthopedics. Brooke Wilson. Oh, it's more campylobacteriosis. Here we go. You need an X-ray of what? You need an X-ray of... Oh, it's CT? Okay, you need a CT. Just normal CT? Okay, there you go. Jordan Lewis discharged. Nice. Thank you for your $2,240. Karen Green is having fatigue and abdominal pain. Margaret Walker is going home. Oh, also I should do CRP. That might help. Oh, she's got campylobacteriosis. Nice. How's the reception? Running amazingly, right? Yeah, I never have to worry about reception. You're doing a great job. Although, the triage nurse is what it is actually, and sometimes they don't do any investigation. They just send them straight to the doctor's office. So, Monsters Inc? I don't get it. What's Monsters Inc? Well, this person's got cholangitis. Admit under surgical for IV antibiotics and everything else. Oh, not beta blockers. Uh-oh, my dog is up. You gotta go and have some... You gotta go out to the toilet, buddy. Just give me a second, guys. I want to take my dog out to the toilet before he does a wee inside. He's a new puppy. Less than... What is he, 3 months old? Give me a sec. Oh, that was your guess, Monsters Inc? You did an impression? Oh, crap. What was the impression? It was a quote. What did I say? completely forgot what quote I did. Often happens. Because I just say random stuff. Appendicitis. Stop doing shit. Surgical. Admission. Laparoscopic surgery. What's wrong with this lady? Gastritis. Breathing problems, chest pain. Joseph Miller procedures finished. Jordan Green procedures finished. Knee arthritis, ultrasound. MRI. Temperature. Okay, ultrasound. I'll send him for an ultrasound if that temperature doesn't work, which I'm pretty sure it's not going to work. Primary peritonitis. Treatment not available? Why not? Ah, yep, temperature didn't work. Ultrasound it is. No, I didn't. Mike Wazowski? I didn't say Mike Wazowski. Mike Wazowski. I don't know. Can't remember the can't remember the quote. Triple therapy treatment. Needs admission, I think. Joseph Miller, pancreatitis, IV antibiotics. Definitely needs admission. Frank Lopez. You did not investigate anything at all. How do I know what to do? Your interview sucks. William Brown, your interview skills suck. Oh, cool. There's an aggressive patient there. Did you hear that? This lady had her CT, which shows a fractured shaft of clavicle. So she needs to be admitted and have all of this stuff done. Maybe not orthosis. If she's having fractured arm surgery, does she still need orthosis? Oh, maybe. Mike Wazowski. Admit. There is no... Oh, because it's an emergency. There is heaps. There is heaps of antihistamines? No. There is heaps of surgical beds. Okay, this person has had investigations completed. They've got what sounds like a cardiac problem. So let's check all this: neck palpation, thorax percussion, blood pressure measurement. So neck palpation is important because they measure your JVP, which is your jugular vena. What is it? There. Jugular venous pressure. And if it's up above a certain level, like if your pulse is pulsating up higher, it's called an increased JVP and can indicate heart failure. This person's having acute renal failure. Wow. And Karen Hall is having vomiting, weight loss, nausea, fever. Can you look in esophagitis? Is that an oral? Oh, neck palpation. Okay. And a barium swallow. Okay, how are we going? 20%? Oh my goodness. Paul Johnson is still in emergency. Still waiting for a doctor, is he? Yep. Where's the doctor? There's no doctor? Well, and where is Brooke Rodriguez? Where's Brooke Rodriguez? There. No? Is she not here? This person's got a shoulder dislocation. Michael Lewis? Oh, what found that? Just the physical exam? Okay. Angina pectoris. Needs nitrates. None of that showed up anything. Awesome. So you either need a barium swallow. Oh, I didn't do thorax percussion. Or a gastroscope. ECG, CT, blood test. Fast. Oh, that didn't work. Okay. Barium swallow. Can I do that through ED? Yeah. It's a fairly reliable test. Sarcoidosis. Corticosteroids. Very good. Rachel Johnson. Muscle pain, fever, fatigue, weight loss. Michael Lewis is collapsing now. Where is he? Is he in the hallway? Yep. He didn't make it to the doctor. Send him to ICU. Chronic fatigue syndrome. Okay. Nice. Still on 30%. Still haven't done anything for Paul Johnson. That's it. Admit. Pretty sure you need to admit for triple therapy anyway. Procedures finished. Physical exam. Oh, great. Dermomyositis. Oral cavity inspection. How not? How are they not available to do an oral cavity inspection? What? CRP? Neck palpation. Viral tonsillitis. Encephalitis or iron deficiency anemia. How do you differentiate iron deficiency anemia without doing a blood test? Speech listening. Oh, can't talk, of course. ECG. Yeah. Jordan Green. Knee bursitis. Corticosteroid injections. Probably needs admission. Holy cow, this day is going nuts. Okay, you need to go. You need to go to be admitted because you're annoying. Because you're gonna need a blood test. Where is it? Blood draw. And then what else did I say it needs? Oral cavity inspection. Can we do that from the ward? Nope. They can do a nasal cavity inspection, but they can't do an oral cavity inspection. Nice, nice. Maybe I should send her to ED for that then. Because the orthopedic doctors can't handle doing a oral inspection. Neck palpation. Alright, that's you done. Dana Johnson now wants something. What's wrong with Dana Johnson? Limited arm motion. Cade Cole. Acute renal failure. Yeah, I hospitalized her, didn't I? Well, I would not hospitalize someone that needs dialysis. That's silly. Hay fever or influenza B? Oh, finally. Oh. Dana Johnson, golfer's elbow. Nice. This person's got encephalitis. And they're just going to discharge. That's interesting. Oh, this person needs angiography. Long wait for bed. There's no bed in surgical HDU. Okay, just go to ICU. Cool. I'm filling out my ICU with HDU patients now. And I can't see, this is fucky. I can't set abdominal surgery in surgical ward. Why not? I can't. Why not? Why can't I do surgery? This is problematic. He needs the surgery. And I'm sure that I have gone through the staffing. But I'll go through it again. Okay, ready? We're on day shift, 11 a.m. We've got someone who can do surgery and assisted surgery. We've got someone who can do anesthetics and assisted surgery. We've got someone who can do assisted surgery and anesthetics. Let's add another doctor. Assisted surgery. None of them can assisted surgery. Okay, do anesthesiology. Okay. Now can I do it? Where's the person? This one. Oh, now I can do it. Okay. It was just... I needed another surgeon. Never mind. I need to get mad. Oh yeah, this lady had barium swallow which showed esophagitis. Nice. I'm on 50% of patients cured. Who is it? Margaret Jackson. She's got cholecystitis. She needs abdominal surgery. Cool. No, wait, what? Laparoscopic surgery. First. Margaret King, appendicitis. Oh, not antidiarrheals. You should only give antidiarrheals to someone who is having drug-induced diarrhea. If they're having bacterial-induced diarrhea, it's not good to stop it because they'll get sick. Gastritis, diet modification. Casey Anderson, peritonitis. Holy shit. I didn't have any on to do surgery. We've got to do 4 surgeries in 10 minutes? Oh, it's not going to happen, is it? Oh, and also I'm going to code blue them. Pharyngitis. Good. Discharge. Oops. Code blue. Theaters. Up. Doesn't matter. Cancel priority. Do Casey Anderson first. Whatever. Foot contusion. Have I got 2 surgical theaters? No, I've only got 1, which I'm sure that one of them has 2. I don't have any. Wait, what? I don't have any internal medicine operating theater? Oh, it's cardiology? I'm going to switch one of these to surgical. What's going to happen? Is this going to break it? Operating room. Nope, it's not broken. Alright, we've got two surgical theaters to get the patients done. Knee bursitis corticosteroids was done. Nice. And he's got a 1-star, 3-star rating. Nice. That's going to drop me down, isn't it? So much for the 90% prestige at the end of the day. Cripsino says, have a reception in all departments? No. What does that do? Do I need a reception in all departments? How does that improve me? It's 2 a.m. I must bed. I'll catch the rest of the stream when I'm at work. Okay, thank you very much, Extreme Matt. I'm surprised you're here. It's pretty late. What are we on, 12? Corticosteroids is done. Discharge. 4-star rating. Okay, better than 3 stars. The theaters are not being prepped. What's going on? What's going on? What's going on? Procedures finished. Serological sampling. Okay, thank you. Do you reckon I should do anything else? I want oral cavity inspection. Should I change her to emergency just to do an oral cavity inspection? Let's see. How's my resus capacity? I've still got 2. Well, I mean, you're supposed to move. Oh, okay, no. Oh, schnitzel. Yeah, I forgot that you can't change them to ICU from there. You have to change these guys to ICU. Or, no, I'm not going to do that. I was going to say I could change this to a HDU. What have we got in here? Gastroenteritis. Oh, blunt splenic rupture. You go to ICU. Renal contusion. Could also go to ICU. But I fear that I might have done it too late. There's 3 nurses here doing nothing. Guys, transfer. Transfers. Oh, shivers. Oh, it's ICU who's doing the transport. Never mind. ICU is retrieving patients. Extreme Matt says, yeah, I stayed so you wouldn't be alone. Oh, you don't have to do that. I'm fine. But thank you. Paul Robinson, ACL injury or knee sprain. Probably ultrasound, right? MRI for ACL, never mind. They both need MRI. Okay. Wait, did they need anything else? Oh, never mind. It was an ACL. Rice. Alright, they've made the space in surgical HDU. So now we can actually get this person off to theatre. There's no theatres happening. Oh, I'm fucked. 10 minutes. Tricuspid regurgitation or CHF. That would need an echo, right? Yeah, that's the one that's waiting for ICU. Oh, you guys? You guys are ortho? Okay, never mind. You're not helpful. I can't fail this, man. I've just done 2 events in a row. You didn't Crip Xeno. What's the reception in all departments? What does it do? Does it help me out with getting theatres done? What? How does it help me? Oh, that's meant to be the internal medicine theatre. Right. No way! I'm still waiting for the blood test. Okay. Well, you can go back to ortho now. I think I might just leave her until I get the diagnosis. Long wait for HDU hospitalization? Shit, where is he? Nothing prepping yet. No one's prepping theatre yet in surgery. And we only have 8.5 minutes left. Frank Lopez, long wait for bed. Where is he? Long wait for what? What bed? Oh, he wants to go to HDU. Okay. Frank Lopez? Oh, he doesn't even have a bed. Okay. Well, why don't you go to ICU then? No, that won't matter. Never mind. Cancel that. One of these has to go to ICU. Gastritis? No. Peritonitis? Maybe. Yep, let's put peritonitis in ICU. Lab symptom uncovered elevated CK, which didn't help because we're still on. so bad? Go for one. Go for gold. EMG. CRP. EMG. EMG. Can't do it. Of course I can't do it. Right, so he's going to HDU now. The base game have no pharmacy? No, there's no pharmacy in base game. I'm planning to get the expansions once I've done all of the... once I've completed all of the insurance objectives for the base game. Where is that? Here. So I've already done uninsured, I've done liver TY, I've done Oopsie Corp. I'm just trying to get these 3 done. Once they're done, then I'll get the expansion packs. CBC testing is done. Yeah, whatever, she's having an MRI now. 7 minutes 36. Are they prepping theatre for anyone yet? No. Oh, fuck. Oh well. Looks like we'll be back to this again next week. Next time. This same 3 epidemic events. Michael Wilson discharged? Alright. $1,200. Okay, how do you differentiate between Crohn's and ulcerative colitis? Stool analysis, blood test, CRP. Inclusion body myositis. She needs corticosteroids. Sarah Wright. Jane Wilson. CT enterography. CT will be the defining factor there. I just missed a message, I think. Not can wait till after stream, which will be in 7 minutes. There's still no theatre? Oh, thank goodness. Someone's going for their operation. But I need like 4 of them, don't I? Oh no, I only need 2. Gallbladder rupture. That does not sound good. Priorities. Margaret Jackson. I don't think, like, I've got 2 theatres set up, but I don't think I can do 2 operations at the same time. Oh, she's already hospitalised. Okay, I have all this stuff. I don't think I've got enough staff for 2 operations at the same time. And getting staff for 2 operations at the same time would be insane. Oh, are they? No, that's the doctors. The anesthetist, the I don't know. Oh, the assistant surgery, the anesthetist. The surgeon is Elizabeth Lee. The assistant surgery is Michael Jackson, and the anesthetist is Jessica Moore. And the 2 nurses, most important part of the team, Jane Davis and Mary Miller. Oh, Mary Miller is what is that? The anesthetic nurse or the scrub scout? And this is the scrub nurse. Scalpel. What does this symbol mean? Hands off. Suction. Suture. Close him up. Good job. And then the cleaner just wanders in there. I love it. Okay, that was one patient's operation done in 2 minutes. Maybe we can get this done. Is she already prioritized to be next? Yes, she is next. And then Margaret King. Is she next after her? No. No, I don't want Margaret King to be there. Do Margaret Jackson first. Just remember to do Margaret King next. After Margaret Jackson's on the table. Where is Margaret Jackson? Oh, cool. Well, she's not far away. Yes, get him off the table. Someone else pick up Margaret Jackson. Are you? Yes. Maybe they're taking her to here. Okay, now Margaret Jackson's in there. Let us put Margaret King up next. And we've got 4 minutes 48 to go. Come on. Let's do... Oh shit, she needs abdominal surgery as well. Does that make Margaret Jackson have a... What is the abdominal surgery for? For the ruptured gallbladder. Thomas Garcia can go home. Awesome, thank you. Just checking that there's no patients stuck. Oh, the fractured clavicle surgery is happening. Nice. Done. Just waiting for pickup. Well, I mean, don't rush or anything, Jordan Martinez. It's not like she's not a code blue. Oh wait, she is a code blue. Hurry up. That would be cool. I just got a message from my kid's school saying there's a Rocketeers holiday program. Procedures finished. Urinalysis. Ultrasound. Let's just do ultrasound. Urinalysis takes too long. What? Everything's done. Oh, waiting CBC. Who cares? We have 3 minutes 44 left. Oh, this one's going to go down to the line. I think Margaret Jackson is going to need another operation to be done, isn't she? Because they don't have to be in the theatre, they just have to be booked for it. Okay, that's cholecystitis treated. Pick her up now, please. Who's the other guy? Yeah, see, Margaret Jackson still needs surgery. Margaret King is there. Oh shit, she's got to come down from upstairs too. Giant cell arthritis or lupus. How do you... Temperature... Ophthalmoscopy, CRP. Makes sense. Chest auscultation. Thorax percussion. Cool, Margaret Jackson's collapsing. Oh, fuck. That's her second one. Fuck. Two minutes. Oops. Did she die? She died. Well, that's it, guys. We failed this event for today. I guess I'll see you next time. And we'll try again. Ah! Yeah, that's Project Hospital, guys. A very difficult game to figure out what the... Once you get past the initial stages of the game, it's very difficult to figure out what the problems are. Anyway, if you want 200 extra channel points, hang around. We might raid someone. Because I won't be back until later tonight when we do Icarus. We're going to do an Icarus stream tonight. At 7 PM Australian Eastern Standard Time. Look, I Am DOS is on. Maybe I should do Panther King though. I haven't seen Panther King for a while. Let's do DOS. She's a fun girl, although she is in Tagalog, so yeah. Thank you guys, and we'll catch you in the next one. Bye for now.